Yes, good morning again, dear viewer. Today is Sunday morning and April the 17th, the 19th rather, and we're almost about 11 days left to the end of April. We'll be hitting May. Summer is coming on, and there are many activities coming on. Like we promise you that we'll be coming in this morning to do a special presentation to you. Some of the activities, some of the events that are going on around us, and one of us happen to have gone out of our own little network, which is more of the Lebialem community or the Cameroon community, and begin to learn how other organizations are doing stuff. And we'll be having that conversation. Dr. Emon, about 2 weeks ago or about a week ago, he was in New York for attending the convention, the National Action Network Convention that took place in New York from April the 8th to the 11th, where there were a lot of discussion. And the National Network Organization is a kind of organization that advocate for injustice or advocate for justice, fighting for, for affordable health, affordable education, voting rights, and all the kind of right that the minority, the challenges of the minority kind of face. It's more or less like, what can we, as the BLM diaspora, learn from this kind of organization, see what they are doing, because most of us here are, because we are kind of like minority or people that do not have full potential to be home, will search for greener pasture in the diaspora, and that's why many of us are here. Then learning from that organization, what can we now do to also improve the life of those that are in the homeland? I think this is where we would like to focus on. This. We'll look into some of the details or some of the agenda of this convention, some of the things that were discussed, then trying to see how we can adapt to some of those ideas and build a greater Liberian diaspora, how we can improve one, education in our area, healthcare, of course, and financial independence or financial responsibility, where people can really do businesses at home with some little financial scheme where they don't have to pay a lot of interest. And I think this is where we'll be diving into. So I would like to bring in Dr. Emon so that he'll be joining me for this wonderful conversation. Dr. Emon, and good morning, and you're welcome to Gaza Media.
Thank you, and as usual, I think that these are always very relevant conversations that should be had in our community. As they say, sometimes a boy who hasn't gone out of the village think that his mother is the best cook, right? You get to
You
out of the village and then you kind of like test some other food and then you can come back and say, hey, mama, I mean, this is something I tested outside and, how can we make this? And then that improves not only your your mother's cooking skills, but it also improve your own culinary skills. And thanks also good morning to all our dear viewers. To hopefully some of these conversations that we bring back, it's not really to maybe teach you anything you did not know, but really to make you begin to see things that are always around you, but you haven't really just perceived them.
Yes, and true, Dr. Emon, and that's quite true. Sometimes you do things haphazardly, but until you begin to narrow it and put it maybe in the kind of a straight line, as they say it, in the kind of a systematic way. But Dr. Emon, my question to you is, I know you have involved in a lot of international organizations. Sometimes you travel to Kenya, Nairobi, involved with so many activities. Uh, but how do you even get connected to this particular organization, the National Action Network?
Yeah, so like I said, yes, I'm in so many international organizations, and all of them, focus on one thing, and that is an area of human development. And realizing that, Africa is a continent that has about 25%, that, roughly 20% of the world's population now, and by 2030, 20 to 2050, it would be 25%. All of them, and that the Africa has the biggest, the largest youthful population in the whole world, right? I mean, the average population, the average age of the population in Africa is roughly between 18 and 19 years old, compared to the aging populations here in the world. 40% of all arable land, that is land that is good for agriculture, is in Africa.
Hmm.
When you start and the resources, should we talk about resources? I mean, your cell phone, the things that me and you are discussing now, all of these things, you have to go to the minerals that are used to make all of these things are coming from Africa largely in the Congo. Um, but you get all of this huge amount of resources, human resources, material resources. Then, but we are also really the most impoverished continent
True.
in the world. And that has to really send you scratching your head and asking the question, what are we doing wrong? Is it that we are dumber than the rest of the world, that we have all these resources around us and we cannot use it? Or is it that we just haven't figured out how to organize ourselves? And I think it is the latter. As I always say, in every community, um, knowledge and stupidity are random coefficients. So if you take every random 100 people from different parts of the world, there will be equal proportion of stupid people and intelligent people, moral people and immoral people. The question as to who grows and who does not actually is a question of how does each society use its its intelligent people, their moral people, the people that are more hardworking and things like that. So it's about organization. That's all. That's all. And so knowing that, as I kind of like as a physician, and as a an academic, I kind of like began relating this, actually looking at it in the community and in our own community, in my own area. For instance, we're here in the US, about the blacks constitute what, maybe about 13% of the US population. If you look at healthcare and say how many of our children get into medical school, the population, it's about roughly 7 to 8%. And that percentage hasn't changed since the 1950s. And out of those, half of those would actually come through the HBCUs. By the time you get to not only medical school, to say residency, meaning you've graduated medical school now, you train and stuff like that figure drops to about 5%. And you go back further and get to the fellowship to people like me, it drops further to 3%. And by the time you get into the academic circles like us, actually you are dropping to less than 1%. And so, but everybody knows that where when you see a doctor who actually looks like you, understands you, speak your language. When I mean your language, doesn't I don't mean in your case now Bangla. I mean but I can see somebody from Kenya, from Liberia, from Ghana, even from sometimes from South America. I can understand their language. When I understand that language, which is the language of somebody who is in an oppressed from in the
Listen.
society,
Yeah.
because I have been there, I'm part of it, I lived it. So there you can they have more, they are more comfortable. I can understand, I can relate their problems. And that is how you improve their health care, and their health. I mean, so by seeing that through that prism, I had begun asking myself, yes, I'm only doing these things in amongst the people that I'm seeing. How do I go upstream to begin to start thinking about preventing people from getting sick before they get into the hospital? But sickness is just not, if you don't think about WHO's definition of health,
Hmm.
what is health? It's not just the absence of disease and
Disease. Physical
or
well-being.
infirmity,
Yeah.
right? It is your total psychological and
Mental state.
physical,
Yeah.
mental, and social and physical well-being, which means that if you are poor, right, you are not healthy. Okay,
Yeah.
if you get up good morning and you are living in an environment of injustice, you are not healthy. And so I had to be looking through it and reading up on a lot of the people who have come before me, read up on a lot of Martin Luther King's work, and one of the things that he said was very, very pertinent. Of all forms of injustices, the injustice in healthcare is the most egregious. And so when you start thinking through that, you start thinking there are problems I cannot fix in the clinic. There are problems I have to collaborate with other people in order
Mhm.
to fix. And who are these people that I can collaborate with? How can we, so you begin looking to some groups where you affiliate. Sometimes it's your academic work, sometimes it's your advocacy work and
Well,
stuff like that, where some of these people begin to seek you out. So not only I'm also part of an organization that we call the World House, which actually brings the Martin Luther King, the Gandhi Foundation, and the Mandela Foundation in the same platform. And so all these organizations, all these big organizations that I get involved in and get invited to speak, you learn from them. What are the lessons I can bring back? The National Action Network, for instance, that has been championed by Ashupton
mhm.
currently, that is actually people need to understand the history of it, especially those of us that are here in the United States. Without people like Frederick Douglass, W.E. Du Bois, Booker T. Washington, of course, the Martin Luther Kings of the world. Without these people, the Rosa Parks of the world, and many more, without them, me and you would not even have the opportunity to be here talking today. And so the the torch got passed from, in terms of specifically from the as the from a social justice advocacy part. That
Mhm.
torch got passed from Martin Luther King to late Jesse Jackson, and then to Al Sharpton. So in terms of who are the moral leaders, and then he brings this coalition together. Yearly, they will bring the greatest group of African Americans,
Yeah,
together.
because on that convention, I saw there
Yeah,
were people like I think former President Obama was there, Kamala Harris was there. I mean, all kind of people that you can think of, top ranking people in the black community or in the minority community were present.
yeah. So actually, this year, what you saw from President Obama was not at this convention. He was a
Okay,
keynote speaker at one of the conventions I attended a couple of years ago.
okay,
Kamala Harris, Vice President Kamala Harris, was the keynote speaker. We were. I mean, my panel just was just after she had spoken. We chatted together. So but you had all the people within the Democratic Party who would be aspirants to the presidency also
mhm,
join the African American, because, as they say, the injustice of the black people. Some people realize that that injustice, as like Martin Luther King said, that a nation cannot survive half free, half slaves. And there are people within the Democratic Party and within generally the American moral society who have understood this. And you look back at history, the history of racism has not been fought by just black people. There have also been a lot of white people
mhm.
who have actually understood that
So,
the human race is just one race.
yes.
And so in today's world, the unfortunately, this is not supposed to be a partisan thing, but in America currently it is. It appears it is, But and so that's why you found more of the politicians from the Democratic Party who were there, and the aspiring one, the president, the governor of Illinois,
Mhm.
the governor of Pennsylvania, right? And then Pete Buttigieg, the former Labor Secretary.
Yeah.
They were all there. Scarborough, who does the Morning Joe on MSNBC, and everybody who is a potential aspirant in the Democratic Party was there. And of course, so when you meet these people, when you meet there, you have the chance to interact with many of these people at some level, and then also share the problems of your community, and not only your community here in the United States, but also back home. And so that's where some of these things become very, 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 very useful to our people.
Yes, and Dr. Emo, at least having this, at least understanding this background and what this kind of network organization, what they fought for, fighting for for oppressed people in general. Like we in the diaspora, like I said earlier, we in the diaspora here are kind of oppressed people in Cameroon, so to speak. Otherwise, we wouldn't even be here. Otherwise, you can come abroad, you study and go back home. We have become permanent resident here or whatever you call it because we are oppressed in our homeland and learning from all of this kind of action work, this kind of idea. How do we, as the BLM diaspora, uh, put together? How do we, as the BLM diaspora, form a network where we can also begin to maybe not just empower ourselves out here, but also empower our brothers and sisters in the homeland. Like Africa, they have most of all of these resources, but yet we are still the people that with the small allowances that we give that will sponsor. I mean, so to speak, in the BLM today, if not because of the diaspora, I don't think many people now will not be even be able to go to school at the amount of, I mean, many household. You cannot count about 5 household in our place where you don't see one of their daughter or son in the diaspora who is actually helping the family out.
Right. So let's think about it. I think we should separate out that it kind of let's split it into two parts in order to
Yes.
not make it too nebulous, right?
Mhm.
The part about how do we in Lebialem, I mean from Lebialem, or generally the African immigrants who came in yesterday to Africa, to
Mhm.
America, right?
Yes.
How do we collaborate with the rest of our brothers and sisters whose uh, parents, our great grand uncles and aunties came here as slaves or earlier through whichever mechanism they came, like you and me eventually joined them here. So that is the one thing that's one aspect,
Yeah.
right? Because collaborating with those group gives us so many different advantages. Number one, there is exposure. Number two, there is you can have the ability eventually tomorrow to access more, not only to tap their knowledge, right,
Hmm.
to help, but also to tap capital.
Yeah.
And you always use the ands when you watch sometimes things that happen within the things that we believe they are the less intelligent, like things like lower animals. These include insects. You can
Hmm.
actually appreciate some real messages, some real actual life lessons, right? If you see the way ants cross a tiny little stream,
Yeah.
they bind together. Because if they go one by one, they will be swept aside. But binding together gives them a force that they are able to cross.
Hmm.
And you'll just like be sitting down, like sometimes I just like, and this is where sometimes watching nature can teach you a lot. And the story of mankind, of humanity, has not been how we have dominated the rest of the animal kingdom. It's not because we are stronger or, as we say, we are more intelligent. If they put me and you in outside there in the wild with chimpanzees or with lions, we have no choice. We have no chance,
Yeah.
right? We only have a chance when we start collaborating together, right? When we start collaborating together, forming networks. And this is why the most powerful thing in humanity, is network. But you can form both healthy and unhealthy networks, right? I mean, unhealthy
Yeah.
networks, and sometimes we in the diaspora must break this cocoon of actually trying to do the things only from within ourselves. So, Bella, people in Bella meeting, if you are in within the Bella meeting, so let's start from charity begins at home, even before we go to how do you collaborate with the people outside of
Right. Yeah,
Bella.
network.
If you're in Bella meeting, but then you are not in Lebang meeting, you are limiting yourselves and you are dragging everybody back because when they start talking about issues of development that the greater Lebanon can provide, which you can collaborate with the other villages to put the greater Lebanon together in order to provide, which Bela cannot provide. You are totally
Loss.
oblivious
Yeah.
to it. It's that Bela cannot survive and be healthy if Nje is unhealthy, if Nje is unhealthy, if Mbindia is unhealthy, and vice versa. So if you're in Lebang meeting and you are not affiliating with the greater Lebialem, you are limiting yourself because there is no way Lebang itself can survive if Allah does not, if Wabane does not. And if you are from Lebialem and then you only limit yourself to interacting with the people in Lebialem, you are limiting yourself. Lebialem cannot be cannot survive if Mezam,
Mm-hmm.
Fato, and all of these people and all of these places are unhealthy. And so you can build that and go down to Africa, out to Africa, and then out to then collaborating with this whole black community that we talked about. Take the histories of the Jews, all right? How many Jews are there in the world? Probably, not more than 20 million. How
Yeah.
many live in Israel? Probably about 4 million,
Yeah.
right? If you disconnect the diaspora Jew from the Jews in Israel, that place is wiped out.
Yeah.
Okay? The strength of the Israel is APAC. APAC here in the US
Mm-hmm.
is the Israeli equivalent of that National Action Network.
Mm-hmm.
They do so many things for Israel. They are the ones who advocate. They are the ones who identify candidates who would be who in this place, if a candidate is actually deemed to not represent Israel's interests, they will raise the money to defeat that candidate. If a candidate here is actually seen as somebody who is favorable to Israel, they will raise the money to support that candidate. And this is how you see at the level of Congress, almost anything that you want to do against Israel, fails, right?
Yeah.
And that is the strength. So that you must actually ask, what is our equivalent of APAC, as
Mm-hmm.
African diaspora?
Voilà.
We in Lebanon cannot get one. We in Lebialem cannot get one. But what we can do is organize ourselves to the point where you from NGE, instead of going there and saying, oh, I represent 500, 1,000 people, if we put ourselves as Lebialem, we say we represent about 10,000 people or 20,000.
Mm-hmm.
If you are a politician and I'm inviting you to speak to somebody who is representing 1,000 versus another person who is inviting you to speak to 10,000 people, where would you go? Where would
No,
you
you
get
go to
your, where would
10,000.
you get your wagon?
No, you go to 10,000
You go to
because
10,000. So that's how number speaks. And this is how we are actually supposed to do this. Plus, when we then get there, we see some of the things that, like I say, you will see what work. What are we doing right? And when we come to our own little community, we're doing so many things right. You just mentioned some.
mm-hmm.
But what are we doing with the things that we're doing right? We enhance them. We maybe even be doing them right. We may have the right idea,
But
but
not you're not doing using the right
we're not doing
methodology.
it as best as we possibly could. When
Yeah.
we go to places like this, we see how other people are doing. We learn. When you then go and then you see the things that you are doing wrong, you change, right?
Yeah.
You change. And if you see things that you are not even thinking about, somebody is going to naturally make you get one idea when they present and stuff like that, and you'll say, "Oh," a light bulb lights up into your head, in your head, and you say, "Wow, we can get this done in our own community."
Mm-hmm.
That is how you empower. That is how you do it, so that someday, some of us like to limit ourselves into advocacy and stuff like that. But there may be people, why can we not actually put our people in the farm? If you saw some of the people I was meeting with, they are like what do you call it? Like the kingmakers, right?
Yeah.
In the Democratic Party. Maybe some people who may affiliate with the Republican Party who have that sense, and maybe their politics lean them to that way, or maybe they have a worldview that can go there. But when you go there, realize, how do you advocate for the interests of your people? So one day I want to see a senator named Atemafe, right? I want to
Hmm.
see a governor named Kengafe, right? I want to see, but this is how you start. It's not going to start by just wishing. It start going by collaboration
Oh,
and things like that. So that to me is that part. The part as to what do we as Lebialem now take to
hmm.
how do we collaborate with the people back home? Start with what we're doing very right here. You just mentioned some things about a lot of the people back home are thriving or subsisting essentially because of the remittance,
Yeah.
from the diaspora. In the sense that it is that money that is sending some kids, kids to school. It is that money that is sending, making people have healthcare. It's that money that sometimes may build little businesses or something like that. But then the question is, could we do better? The answer is yes, yes, and yes. And how can we do better?
Well,
Instead of EK sending your little the money that you send home, or maybe going to build your own tiny little house somewhere.
yes, I can hear you. Hmm. Yeah, I get it.
So that we can use those resources to do things like, establish a financial institution. Capital back home is very, very, very expensive,
Let's see.
right? If somebody borrows money and has to pay 20% or 15% interest,
Yes.
what business are they going to do to be able to pay for this and then use and still make a profit without stealing, right? Or without becoming bankrupt?
Yeah.
Can we fund a certain banks where we could, for instance, say, okay, maybe when we fund these banks, the Magic Credit Union already exists, but we could identify some and capitalize them in a way where we could then sit back and talk to the people back home.
See.
And the community, you're already doing things in the community. This will know by your being a member of an organization like your meeting, your village meeting. They can vouch for you. So we can provide you loans that you can then use to set up. That is one thing. And that those loans will not be at such exorbitant prices
Right.
like the current banking system does, right? We can actually, you can take this money we can create a student's a school fee fund loan in scheme in there, which parents, a lot of our people's money, a lot of our people's income is seasonal. And so when you have a kid who goes to school, and that kid goes to school and the parents don't have money at that time, and then they send this child home, the child, because they have not paid books, they don't have books or they
Hmm.
don't have school fees, when they come and sit home, before the parent looks for money and eventually has sufficient funds to send this child back, this child, probably some of the children may never recover from the periods that they got the
They
two,
were home, especially if
right?
some. Yeah.
But if there was a fund that they can go and access, and these criteria can be developed, that fund they can go and access, then, at a minimal interest, remembering that the whole purpose of that particular scheme is not to make money, but it is to develop human capital. It is
Yeah.
to develop our people who would tomorrow replace you and me and fly the flag of Lebialem. So that is one beautiful thing that we can do. Now, I come to another area of collaboration that I'm already beginning to see, but which is not being done. appropriately. And that's actually look at healthcare.
That's
When
why
we started,
that's why I wanted to dive into the issue of affordable healthcare for
yeah,
our people.
yeah. So right now, when we started healthcare, me and you had spoken about this. I don't want to go back to it in terms of like how we began delivering our own healthcare or like what we call health campaign.
Yeah,
The original version of what Lebialem, for instance, actually had as Leban Health Campaign, Lukudu USA Health Campaign. It was actually to meet the needs of the people who, our people who were refugees in,
yeah,
outside, mostly in
outside.
the Western province, and also the people who were left back when all institutions, all healthcare institutions have broken down. And we decided to establish that. And as time went on and the people were going back, the most important thing was okay taking it back home. But we began collaborating for 2 years. We collaborated with Alo,
Hmm.
right?
Yeah,
Jumeto. Um, but this past year, we went it alone again. And then I saw Esota has actually copied, but
copy
then
from.
we're going it alone, right? So when you fragment things like this, how do you, it doesn't really, it serves a need, but not really, it's not as efficient. But you can think about it as Lebialem coming together and actually asking the question, what is it that we really want to accomplish? Is this disease prevention? Is this early detection?
Hmm.
Is this, treatment? What are the existing resources that are there? And not only within the BLM, but outside. That is because we have also expertise, the BLM expertise, or
Yes.
expertise that we can hire in Cameroon. For instance, most of these places, some of them, Azi Menji has one doctor or two doctors right now. I mean, Mary Health has two doctors now.
Hmm.
I don't know whether Sota even has any, because what I saw,
No,
I
not
don't
yet.
think they have any.
From the reporting, they
I
don't.
used to have one which, for during the crisis, it was actually paid by Lokudu in some sense. And that was really a nice thing that Lokudu did. But we should enhance that by asking the different presidents of these organizations to come and sit around the table and say, how can we do this better? How can then we take all put our healthcare experts, all the healthcare people, nursing, pharmacies, doctors together, those that are back at home and those that are in the diaspora,
Yeah.
and say to ourselves, how can we best deliver healthcare on a continuous basis? It's not once a year we go and do a health campaign anymore. That system is outdated now, is outmodeled now. We need to figure out what resources, for instance, Menji doesn't have an ophthalmologist, they don't have a psychiatrist, they don't have an internist, they don't have trained surgeons, they don't have all these other different aspects that we could actually be able to hire them in Cameroon
So,
and then have them go time and again. And the rest of us can support with telemedicine, right? Through
yeah.
telemedicine,
Yes.
because technology has now
Make
flattened
it.
the world.
Hmm.
I no longer need to travel to Cameroon. I deliver care around the world, literally, right now, sitting in my office, sitting sometimes in my house, right here. And if I can do that around the world, why can't we do that actually in Lebialem? And it cannot be haphazard. So I guess
Yeah,
long,
and that's true, Dr. Emo, not to cut you short, and that is actually true, especially because you make maximum use of the personnel that you have a greater outcome. For example, if you have expertise in certain area like oncology, internalists, as you are mentioning, cardiologists, there may be few, but if you collaborate, they will be able to, deliver services to many patients. Which, if say for example, the bank is doing their own, a sorter is doing, a sorter doesn't may not even have a cardiologist. But say for example, if the bank has a cardiologist, but if you are already working in collaboration, therefore all the patient, all those people with cardiac related illnesses may be referred to this particular specialty or this particular doctor where they could easily be seen. But if you begin to do your own individually, it is very difficult for you to maybe say, okay, you want to pull a cardiologist or pull an expertise into your own little corner to do your own little stuff.
Right.
Yeah.
Plus, just look at what happened. Laban, during the Kudu Health campaign, there were quite a number of professionals that were taken to, they were already in Menji, right?
Yeah.
So, okay, if Libya Sota has to do something now 2, 3 weeks or 1 month or so later, these people cannot go to Sota. Do you understand? I mean,
Yeah.
like these experts, but if they were already there and the Sota had actually collaborated with Lebialem, and this was a Lebialem wide initiative infused within the different fundoms
Found them.
organization, then those people can then easily just get to a Sota to take care of the people who could not move to Menji.
See. Mm-hmm.
You see what I mean?
Yeah.
And so the things that you can do physically, you're already in Menji. And sometimes you're passed through a law to go to Menji,
See.
right?
Mm-hmm.
But then why can't you not stop in a law
And
and
work
things
and
can
just do
be
what's supposed to do there.
right? So I'm just actually pushing our people to begin to think that all this balkanization or all this fragmentation of little things that we do, maybe somebody is thinking, oh, maybe I'm the president of this, and maybe I just want it to be known that I'm doing this for my community. No, 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 no. This is not. You're not helping. You are actually impeding progress. The key question should be we must ask those key questions about collaboration so that why people do things that they can do internally as individually, just like you are in your community, you have
Mm-hmm.
to sweep your house, but your house is also within a community, so you
See.
have to actually like pay for the house home ownership. You have to
See.
belong to a home ownership association
Aspiration.
or some other grouping and things like that. That actually takes care of everybody else because you really cannot just do it alone.
And that's quite true. And I think that this is where we really need to learn, because sometimes it may be lack of knowledge, or when people have not really sat together to really share this kind of thought and say, hey, what are you doing in your own area that we can copy? Like we're talking about, like the summer is coming. You see so many convention, so many back to back, left and right, donation here and there. Sometimes it's very exhaustive because every little organization they want to do it. That is fine, but do we really have maybe a bigger system where there's a structure that,
Yeah.
okay, you are doing fundraising, these are the projects that you ought to be targeting. This is where, because sometimes we have reputation of stuff, like, do you how in this area this is what is lacking, in this area this is what is lacking, so that if you still now say, okay, if you are doing fundraising, there's already a school year, so you should not be raising money again for another school. Maybe there's healthcare that is lacking or a health center. They can now focus on maybe purchasing whatever that you have to do to improve on that health institution that is lacking in that area. So
Right.
it's more
So
coordinated.
push that a little bit. Leban is going to have this summer. You will have Lukudu, Lukundem. I'm not sure Mwebeto. This and so on and so forth. Everybody will be having Esota and all. Everybody will be having their organizations or maybe their conventions, right? Look, when we get these conventions, I mean, for our people, I mean, in Lokudu, for instance, how many times do you see somebody from Lukundem or from Esota attend those conventions beyond just coming to donate or maybe ask for fundraising, right? So, what is it that Lokudu is doing right that Esota could have learned? That Logo could have learned, that these people could have learned. And if you are not actually interacting, how can you collaborate? Right? I mean, so that's a key question that we must ask ourselves. The same thing is going to go even when you break down in JA. And I'm sure that if you go to Lobo and do maybe or other places that now have villages within them organizing convention, like we'll have Jensa, we'll have JA, we'll have Lekong, we'll have this. Some people would attend one of these and then they will be champions at it, blah, 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 but then they don't attend the bigger organization and then you cannot actually even know. The arm is almost useless when it is detached from the body. Okay?
Yeah.
So, and if the ear is not there to hear and then use for the brain to synthesize and instruct the arm, how can the arm actually better it can do the job that the arm is supposed to do? And if the same thing with the eyes, if the eyes are not there, to see,
Yeah.
and then even though the eyes may it will see, but it is the hand may do the thing.
thing.
So, but you need all of this coordination in order to be able to have a more effective thing. And so, few things that we must think that we, and I think part of this is lack of trust. So we must rebuild trust amongst ourselves. The other one is poor coordination. We're just talking about this. The leaderships of these different organizations may start by thinking like, how do we put coordinating bodies together to look into this problem and areas of coordinations and collaborations where we can do. Other things are short-term thinking. When you think short-term,
Mhm.
it never really allows you the ability to be able to tap into the worth of resources that you have to plan long term. And projects are always like somehow just not efficiently done. And the other
Dr.
thing would
Emo,
be, yeah,
Dr. Emo, before we forget, let's go back to this educational. I really want us to
yeah,
really talk a little bit on this educational issue of this in terms of collaboration coming with the use of technology now,
yeah,
or even before the internet, where we will have people here in the diaspora where to develop maybe a kind of some of the lessons. You can develop some of these lessons and
yeah.
put it on the archive or whatever flash drive, where you can actually go into some of these schools that are already well functioning, some of the secondary school and high school, and all of them on the computer, where students can actually learn some of these things and really improve on the academic. I remember in the days where there used to be pamphlet, this kind of small paperweights that they do and buy and sell them.
We used to call them polycarps,
Oh,
right?
okay.
Polycarps. Everybody knew about polycarp. Me and you have spoken about this, and I've spoken to some of the leaderships of our community about this. And the think back, and I just want, it's always good to be practical about things that we're talking so people can understand.
Hmm.
There are quite a number of our people here who did what we call back home arts and came here, and many of them have, advanced degrees in science-related fields, including a majority of them in nursing areas, right?
Hmm.
And many of these people ran away from math back home. They couldn't do math, they couldn't do biology because somehow somebody told them that they couldn't do it. But the problem was that the person who was telling them that they couldn't do it, or whether they had this perception, is that one of the biggest problems is these people didn't even know how to teach. All right?
Hmm.
If you had a teacher who had one A level coming to try to teach A level, or maybe somebody who had three O level coming to teach O level kids and stuff like that, many of these people had no idea about what it meant, that like understanding, mastering the material. When you don't have the mastery of the material, it becomes very difficult for you to transmit the material.
Yeah.
So if we then do, when these people came here, when our people off to come here, they get here and because of they need a job, and now they have to go and do and learn something, and that would allow them have a job. Then they have to end up in nursing, and then they go, and then somebody who understands the biology breaks them down, who understands the math and breaks them down and teach them, then all of a sudden they realized that they were not dumb after all. They could understand this. And you see many of them flourishing.
Hmm.
That has got to tell you something that these our people, our children, if we go back, and part of the other thing that we should look at is actually as we're looking at the students, the teachers that are there now, it is not only in terms of the lack of ability to do, but also the lack of the numbers themselves. And we've talked about just creating this cloud
Yeah.
space, or and we have student people here who have degrees in physics, who were teachers back home. Some of them are teachers here. You can take some in math, some in chemistry, some in biology, some
Biology.
in literature. Just sit back, take whatever field you have, take the content, look at the syllabus of Cameroon schools, and beyond the syllabus, ask the question, what should a child at that level know? Develop lecture series, put them on the internet, put them like we do Google. You go to
Yeah.
YouTube, right? You go to YouTube all the time, and when something is difficult for you to understand,
No, you go
just
to
maybe
YouTube.
you go to YouTube. Some people would break it down very, very well, easy for you to understand. So we can do that for our schools and put them there in those computers. So in now, so that the child, both the children and the teachers, have
Yes.
access to this, right? Have access to this. So then our next big project then only becomes supplying internet, which now we have Starlink.
Yeah.
We can use that.
No, Dr. Emo, before
So
before even go to internet, if you do this thing now, even offline, they load this program into the computer,
yeah,
they can still use it.
yes. No, I'm just saying that we
Yeah, I know, I
can.
get the point.
There
I'm saying that
is,
even before the internet, even
yeah.
before, I'm not saying that the internet is bad, but I'm just talking about like if you design some of this
No, if you are
program,
looking at the cloud, right?
yes,
Sometimes the problem with just loading them on the internet may
the
become space of
space.
the devices that they have. I'm not a
Mhm.
technology, but I'm not a techie person, the IT
But
folks.
yes, yes, sure.
So
But if you
we
have the
can bring
internet,
our
it will be
IT
the
folks
best.
into this conversation, into this conversation, right?
Hmm.
Into how do you do this? And this is where thinking matters. And this is why I really wanted us to get this project, this particular thing done. Like we've talked now about this particular program done. So people can begin to think that there is a way that you can help beyond just donating money,
Money.
right?
Hmm.
There is a way that you can help, which you don't necessarily need to go down to Lebialem
Yeah.
or to to Cameroon to help. A lot of the people who sit down now and do and teach IT and teach all the things that are allowing you, like all this creating all these apps that are allowing you and me to do now,
Yeah.
many of those people are sitting. These things might have started in Silicon Valley, but somebody is sitting in Silicon Valley and communicating with somebody in Delhi, in India,
Hmm.
and teaching them how to do this. Why can we not do the same?
Exactly. Exactly. I think this is kind of I think this is important to about this national action network where you actually network and begin to think a little bit wider outside your comfort zone, so to speak. Like say, hey, how can I step outside here? What is really outside there that is different from what I'm doing here, or what I'm doing? Can I improve it and take it to another level, another different level that can impact more, that can get a greater impact?
And let me just mention one thing also, Ike, that's okay. Too often when we come, we think about projects ourselves in the diaspora,
Hmm.
right? Sometimes it is because somebody from home has told us. Sometimes, most often, it is us who have picked up these projects by ourselves, right? What if you create a database of where you just get young people with just cameras, go back, talk to the people back home, figure out what their real problems are, load those videos in a website where all of us can see,
See.
right? Load out, water. What is the water situation in Bindia? What is the water situation in Lebo? What is the water situation in Wabane? Ask what can we then do so that we can understand this. Talk to the women. What is your problem about in terms of what would you have done if you have access to capital?
Yeah.
Right? How the girl child, what is stopping you from going to school? What are some of the things that you wish you had and things like this? Talk to them. Put these things on a website where we can see,
See.
right? There should be another group that where transparency becomes really a watchword, and you can actually help to organize the community and begin to form like little community like town halls
Hmm.
where they can bring people together, talk about this. And I don't want those people back home to continue to be just passive participants. Because when you bring a project that the people back actually don't actually think about the projects themselves, and they don't see themselves as the ones who actually had
When they share
say
this, they don't.
in
The
initiating, it
passion
doesn't
is.
really mean
It doesn't
anything to
mean
them.
much to them.
It doesn't mean much to them. And so you may have these projects without ownership. And having projects without ownership means that the projects will not succeed.
It will not. It will not. It will not. It may succeed, but it will not be able to sustain.
Yes. So I would ask the other question in terms of like, do you even know the sources of income of your of the council? How does the council function? Because that's another one area where we have to do a lot of education. How does the council function?
Hmm.
Well, how does the income what are their sources of income?
Okay.
What are their sources of expenditure? There is something that community developers have now called the glass the glass back,
Mm-hmm.
hypothesis. So meaning that everything is transparent, right? When they come, and we know what money is coming to a particular council, how much money that is, what is the money? What
Yeah.
is this money meant for?
For
What are these projects, and the projects, what is the scope of a project?
project.
All these things are done and put there transparently. When somebody gets the money to start, actually the money comes, we know the money comes, and then you start spending, and every step of the project somebody is looking and
And
saying,
see,
yeah. And then this is how you actually, extrude, you stop corruption or limit corruption.
John.
And you got to think through all of these processes that are actually going on. And I don't know whether the mayor of the mayors of Lebialem actually get together to actually ask the questions. Okay, you are the mayor of Wabane, I'm the mayor of Alor,
Alone.
and he's the mayor of Menji. What are the things that are common to us, right? What
Mm-hmm.
are the things that we must do to uplift ourselves together? And I want mayors, when they come here next time, not to talk to us about, the mayors must come to us and present us with a an opportunity, an area of opportunity where it's not about charity. It's about for us to invest in order to be able to either, not only improve the lots, but also make, you can get a return on, you should be able to get a
Yeah.
return on your investment,
Fine.
right? Take Lebialem. Lebialem is sitting at a point where west to us is a 300 million persons market, a people's market, right?
Mm-hmm.
That is the whole of West Africa. It is easier to go from Lebialem to a COP in Nigeria and join
Yeah.
Nigeria,
Market.
where you have access to 300 million market than it is to go to Douala
Mm-hmm.
in many places. How do you build a road that connects to that Trans-African highway? How do you build a cooperative? How do you provide incentive funds for us, for young people to no longer live and have to go to Ekata or to Bafia,
Yeah.
but
So that can stay home.
stay within the BLM, right? How do we identify a lot of the schools in the BLM are political schools, right?
Mm-hmm.
You have a secondary school in
So,
Menji, you have a secondary school in Ka, you have a secondary school where are the children?
exactly. There are just so
Where are the
many schools.
children?
There are
These are
just so many
political
schools.
schools. These are not schools based on education need. Then you will send 7 teachers instead of sending all those 7 teachers in one school that where the numbers when you were in your time in your class, you were probably 60, 70 of you or
Yeah.
50 of you
Yeah.
in one class,
We
right?
were we were ABC, and one A was 60 students.
Right. But think now in this community, in this schools now, you have an entire secondary school that is not up to 100 people, even before the war, right?
Yeah.
And then,
Uh-huh.
but you have 3 of those. I mean, are we serious? Like, seriously? If you brought these schools together, it would be easier for us to be able to fund those schools. It would be easier for the government, for us, even supplementing, even helping with teacher, providing whatever thing we want to pay.
Yeah, because if you get, especially like in some of these areas where some of the child are usually very shortage or whatever, the physics and math. If you have like good teachers, good of those three of those child in one school, they will be able to put their knowledge together and deliver effectively.
Yeah.
Rather
So
than
those
just
are the
very
things
smaller.
that we must, as a people, now at this people, try to your leverage in my belief. Just learning from what when you attend meetings like this, you hear different sorts of people from different communities. What the Kenyan diaspora is doing, what the Ghanaian diaspora is doing, what the this diaspora is doing, and things like that. So that's a part of.
No, Dr. Emma, no, I want to thank you so much. I think that was mind blowing, especially and it really, dear viewers, sometimes it really open your own scope, develop you as an individual. Because Dr. Emma, even some of the questions that you were asked that I shared, like one of the essay, were a very tough question that if you somebody who have not been maybe be reading and follow us on this thing, you may find yourself, you may stupefy yourself in the kind of big platform like that when somebody asks you about AI and how do you use AI into all of these research trial that will affect, and you answer the question so well, which is something that many of our community face when, especially when they are doing clinical trials, when they say people should come and volunteer for the testing of the drug. Many of our people do not go, or sometimes intentional or bias we are left out. And when the drug is finally developed and marketed, it do not work for us because we were never tested. Then we begin to have certain side effects because we're never included in the testing or in the development of those drugs, so to speak. I think you did so well, and I really appreciate you for at least we see ourselves through you. So sometimes like that.
I mean, I think I see myself through you people as well. As I always say, the African philosophy of Ubuntu, right? I am because you are,
Yeah.
and which is the philosophy that we should never lose sight of. I always say when you come out, there are things that we do so right, which is really this continuous communal belonging. That is has its weight in gold. But we must exactly try to expand that beyond that and make sure that we are able to, um, improve on that. The
Hmm.
one thing where I would really urge us to do better is to make use of our experts, right? In not to come and be our drinking buddies, not to
Hmm.
come and contribute for funerals and stuff like that, and so on and so forth. Those things they have their role, but they're very limited ways in which we use our experts. Every community that would grow needs to use its experts.
Yeah.
And when it comes to things like healthcare, for instance, as I always mention here, many of us are not just for me, it's not just um, having to use us in, say, you come to the hospital where I work, because
Hmm.
that will not be possible. But here in the United States, when you get diagnosed with cancer, for instance, um, as cancer is a very complicated disease to treat, and you can go into two people can have the same cancer, and one person ends up in one healthcare institution, treated at an institution, and the other person ends up in another institution. That can be the difference between survivor and not survive and not,
Hmm.
right? So the best thing to do is when you have this stuff, who do you can you contact somebody who can then be able to go through with you, walk you through what needs to be done. You just mentioned clinical trials. We've had so many instances where when they invite you to talk to participate in clinical trials, people think, oh, they're gonna use us as guinea pigs. Yes, I can understand and appreciate where some of that anxiety is coming from. The Tuskegee
Hmm.
experiment, where our people were experimented
Yeah.
on,
Hmm.
but there is also a lot of other places where even also the whites themselves were also experimented on. In fact, one little known fact is that during the Nuremberg trials, when they were trying the Jews, I mean the Hitler's and his cohort for experimenting for using the Jews as experiment, one of them simply just said, "Look, we learned from America," and that is true. But that has changed a lot. We are no longer there. In
Hmm.
fact, if anything, the pendulum has swung so far in terms of how do you protect subjects? How do you
Yeah.
protect people who are participants in clinical trials? And this is why it in itself is a different area of expertise, which are things that people like me get specialized in. and you go through training, you go through training for everything else, and you need to be at the institutions that are at the level that they can be able to create to actually conduct this. But in doing that, you also understand what is actually out there. You also understand, you relate with people to understand the things that, or maybe you understand the system. So I understand the healthcare system here better than most,
Yeah.
so that if somebody were to have a problem, then you'd let us know. We would be able to. You just reach out to me. I mean, I always say, you know, and for the people to to also address the needs of our people back in Cameroon, which of course we have a cancer center. I mean, which be it as as at least in Cameroon, that is the standard. That is the best that we can
So
have.
far.
But I know the things that we can do in Cameroon and the things that we cannot do. And because of that, I've also established collaboration with India, since I cannot bring our people here or to Europe. So I have really good institutional collaboration with India, where most people, if you want to go, if your healthcare situation and beyond cancer needs you to go there, you can let us know, and we can find
Mhm.
the best places for you to get there. And when you get there, the most affordable, and also make sure that when you get there, also once they know you're not just there by yourself, you are
So,
being followed by a group of doctors
sort of.
who know what you're doing. That always is something that cannot even, its value cannot really be measured in terms of money.
And that's quite true. Dr. Emma, really thank you for that. So, and it's all boils down to this kind of action network that we've been talking about, trying to build this network, making connection, knowing who is who and who to contact at what time and stuff like that. So I think we'll pick up this conversation as we move forward. And I will also want to add that some of this convention, like we'll talk about the Kudem sort and wanted from Mabuto, that they can prepare, give maybe a slot for this kind of this thing, or like the youth, the younger generation, to begin to have kind of discussion center on this kind of professional development and networking. And I think that will, from there, we can begin to see how we can move forward. I want to thank you so much for coming this morning.
Thank
Yeah.
you.
Yeah. So,
Yeah,
yeah, we'll see you next time. Thanks so much.
and let everybody know, if for those who cannot get to me directly, if they need me, since they all know how to get to you, they can always get.
Yes, no, I will always link them through. I know, Dr. Emo, I know some of the work that you have done. I cannot say I'm beginning to enumerate them.
So,
There's a lot, yeah. I know, like, how many people have been referenced to India and they succeed and all of that. So it's a ton of work that you do behind. That sometimes the time to say and talk is very limited. Well, thank you so much. Yeah,
all right. Thank
yeah,
you.
yeah,
Thanks.
yeah.
Hello.